Hi, everybody. It's time for Module 15 in Careers in Addiction Science. And this module is designed to put all of the course material that you've encountered thus far into a broader context, some of it historical, but mainly the kinds of things that will indicate how important it is for you as an addiction scientist to engage in networking with your peers as part of what we call the invisible college of people who are knowledgeable about addiction, and how a career in addiction science will help to provide meaning for your own life. A good way to bring this message home is to consider the life of Griffith Edwards. And this week you'll be reading some of his writings. Griffith was a master at networking, and he also was a participant in the modern history of addiction science. And the modern history of addiction science is a period when addiction science became globalized. So global networking is important if you're going to have a successful career. Before his death in 2012, Griffith drafted a memoir, and you're going to be reading one of those chapters. But first, a little background. He was born in India in 1928. His father was a veterinary scientist and a journal editor. He worked in a laboratory in the Himalaya Mountains. Griffith, when the family moved back to England, was educated at home by his mother. He somehow got into Oxford University, in part because of his brilliance, and migrated towards medicine. He then went to London, worked at St. Bartholomew's Hospital, and after a few years wound up as a physician interested in psychiatry at the Institute of Psychiatry at the Maudsley Hospital in London. He specialized in addiction studies because of the influence of his mentors, became the director of the Addiction Research Unit in 1967, then editor of the British Journal of Addiction, which eventually was transformed into the journal Addiction. He was a professor in addictive behavior at the University of London, and director of the National Addiction Center. During his life, he was engaged in a variety of different research projects, which pretty much defined the main issues and controversies from the 1970s up until a few years ago. Initially, even though he was a psychiatrist, he was interested in alcohol policy and community and psychiatric epidemiology. So he was part of a seminal book published by the World Health Organization called Alcohol Control Policies in Public Health Perspective. He wrote a paper with Milton Gross called The Alcohol Dependence Syndrome, which initiated a series of studies and theoretical papers on the nature of alcohol dependence, which eventually was incorporated into ICD-10. He investigated the treatment of alcoholics through controlled trials of brief interventions versus more intensive treatment. He studied addiction from a historical perspective, and also the treatment of drinking problems. He wrote a book called Alcohol Policy and the Public Good with a set of collaborators, which was published in 1994, and a number of other books as well. So he had a wide-ranging career in clinical psychiatry, addiction medicine, alcohol policy, and historical analysis, which added up to 192 papers and 40 books. Above all, Griffith was a networker. He networked within his own group in London at the Addiction Research Center and nationally in the UK in order to promote addiction within or addiction treatment within the National Health Service, in order to influence addiction policy for opiates as well as alcohol at the national level. And he mentored people from all over the world. So people would come to London to study at the Maudsley Hospital, to do residencies, and Griffith would encourage them to study addiction. And some of the leading addiction scientists in the world came out of a mentoring relationship with him. As part of his career, he traveled extensively, but he did it not just to impart his knowledge or participate in research projects and collaborative kinds of things, but he also did it to learn from others. And what you're going to be reading this week is a section of his book called Traveling Lightly. That's part of the book, Seeing Addiction. And besides being an international leader in addiction science, you can trace the career that he had by looking at these visits that he made to different parts of the world, visiting North America in 1961 and 1967, and working for the World Health Organization and visiting Africa in 1978, and going to Russia in 1989. And along the way, he found time to pursue his own personal interest by visiting Mother Teresa in Calcutta in 1970. So he traveled a lot, he made friends, he worked with colleagues, and he developed an international network of people who communicated quite frequently, collaborated on many different projects, and developed a consensus around concepts in the world of addiction as to what was important to study and what types of language could be used to study it, what types of methods. And all of this came from networking with different people. And it was not just Griffith, but the entire field began to become much more unified during this period. So what you're going to learn is that networking is the ability to interact with other people, to exchange information and develop contacts. And it's not just to further your own career, but to advance your ideas. And addiction science, because it's embedded in this global network of people trained in a variety of disciplines, requires that we network across disciplines, but also across cultures. And by communicating with people through the peer-reviewed literature, at conferences, through inter-institutional collaborations, serving on expert panels, going to conferences where you're on a symposium with people from different countries or different points of view, serving on grant reviews, and joining professional societies. All of these things provide you with opportunities to network, but also give you exposure to people who represent the key ideas in the field. And the message here is that networking is really essential if you're going to get access to collaborators, to funders, and to the ideas of important colleagues. So travel to distant places is not only good for networking, but it's also a good way to see addiction from different perspectives. That brings us to the future of addiction science. If you're going to get into this field, why would you want to do it? Well, there are some very good public health reasons. Consider the fact that the misuse of alcohol, tobacco, illicit drugs, and other unhealthy and potentially addictive products like gambling add up to the risk factors that account for more death, disability, and disease than just about any risk factor for any variety of health conditions. So addictive substances contribute to an enormous variety of death, disability, and disease. And for that reason, because addiction is becoming globalized, we need addiction scientists to fill the need for knowledge generation, as well as teaching, mentoring, and developing new addiction research and addiction science. For those reasons, there is going to be an increasing demand for addiction scientists in academia, in nonprofit organizations, in research centers, in public health agencies, in treatment programs, and in government organizations. And you can all be a part of that. One way to illustrate where addiction science is going as a career option is to follow the career trajectories of prominent people in the field. And you've already started to do that with the readings from last week and from the videos. This week, you'll be introduced to two new videos, one with Isidore Obat, the other with Robin Room, two very prominent addiction scientists. Isidore was born in Nigeria. He was trained as a social psychologist in the United States. He worked at the World Health Organization in Geneva. He served as a department chairman at Morgan State College in North Carolina. And then he returned to Nigeria to set up a non-governmental organization that advocates for evidence-based alcohol and drug policy in that country and throughout Africa. So he's had quite a career. Similarly, Robin Room was born in Australia, got his PhD in sociology from the University of California. He became the director of one of the first alcohol research centers that focused on the social aspects of alcohol and other addictions. He then migrated to Canada and Sweden, where he was a center director at research centers in those countries. And finally, he's returned to Australia at the end of his career, again, as a center director. As a social epidemiologist, Robin has contributed to a variety of cutting-edge developments in addiction science, including the documentation of harm to others in national surveys conducted throughout the world, as well as seminal work that he's done to document the contribution of alcohol to the global burden of disease. So both of these individuals epitomize the values of addiction science. And what should become apparent when you look at Griffith Edwards and Robin Room and Isidore Obat and Kathy Carroll and Wayne Hall and other people whose careers have spanned the course of 30 or 35 years in addiction science, is that publication is the linchpin of what they're engaged in, what they're doing, and how they communicate to have a successful career. So, as we've noted in other parts of this course, publication ethics and research integrity are critical to a successful career in addiction science. We've got to try to represent the values of universalism, that is, that science is universal, addiction science is universal. It applies to everybody, not just people in our country, not just to the rich countries, not just to the English-speaking countries, but we've got to look and find universal relationships all over the world. We need to be able to share our scientific findings and be transparent in the way we communicate and not have proprietary information. We need to be, as scientists, disinterested, not disinterested in the outcomes of our research, but we need to step back a little bit and make sure that our own passion for science doesn't get in the way of objectivity. And that means we need to have organized skepticism, which we learn in science, to always question our assumptions and to make sure that our scientific results can be replicated and to be critical but constructive with regards to the research of others. So that brings us to the meaning of scientific life. These values are likely to compete with modern concepts of big science, of people competing for prestige to get their name out, of distortions of the truth in order to achieve fame or fortune because of conflicts of interest. And what we need to get from this course is that publishing with scientific integrity is the centerpiece of a productive career. We need to incorporate these scientific integrity values into what we're doing in our everyday life. And one good thing that will come out of it is that by being an addiction scientist, we share these values with scientists all over the world. And going beyond what the philosophers and the theologians have told us about the meaning of life, we're going to learn that addiction science itself is a useful tool to pursue meaning in life, in part because addiction, on the flip side, is the antithesis of having a meaningful life, because people's lives get taken over by an alien object that they ingest into themselves. And if we can discover how to relieve people of that burden and to free them, we can also learn a lot about freeing ourselves. So what's the meaning of scientific life? Well, however you use science to advance your career, you need to be answering some fundamental questions. Have you avoided meaningless research projects and writing projects that lead to publications that nobody reads or nobody values? Have you worked amicably with your colleagues and supported their ideas and given credit where credit is due? Have you considered the plight of the alcoholic and the drug addict and their families when you're doing your research? Have you promoted evidence-based treatment and evidence-based policies and practices in your own work in order to make sure that what you're doing has an impact on society? The final chapter in Publishing Addiction Science tries to help you answer some of those questions. And it indicates that being a scientist in any discipline, but particularly addiction science, is a special calling. It brings with it a passion for finding answers to life's persistent questions. Most of all, it's interesting and it's fun and it's meaningful. And if you know that you're contributing to the fund of knowledge and at the same time helping to make society a little bit better, then it's very rewarding. So one more added benefit, you'll never have trouble at making conversation at a cocktail party if you tell people that you're an addiction scientist. So in conclusion, addiction science is a wonderful way to add benefit to society, to add depth to your own understanding of human nature, and also it's a good way to have fun.